One of the biggest fears of surgery is blood clots. Blood clots typically, although not always, begin in the legs in the deep venous system. These blood clots can then travel to your lungs, which is called a pulmonary embolism, or PE, and this can actually be life-threatening. Symptoms of a DVT can include, but are not limited to, throbbing pain. This is usually in the calf or the thigh when you are walking, standing up, or when you compress the legs, swelling of the leg, and tenderness whenever you lift your foot. These symptoms are usually just in one leg, but rarely they can be in both. If a blood clot is in the lung, a pulmonary embolism, signs can include, but are not limited to, shortness of breath, chest pain, anxiety, dizziness or lightheadedness, or even fainting. You can have irregular heartbeat, coughing, or even coughing up blood and sweating. There are some risk factors to keep in mind: age over 60, elevated BMI, tobacco use, history or family history of blood clots, hormone replacement therapy or oral contraceptives, history of cancer, varicose veins, decreased ambulation or activity, and dehydration. So how do we prevent blood clots? Through one or a combination of the following: compression boots at the time of surgery, known as SCDs, compression stockings. We get you up and walking early after surgery with ambulation, exercises for the legs, keeping hydrated. Also, preoperatively, we look at you as an individual and run a risk assessment. This is helpful to assess your risks, but there's no foolproof method to predict who is going to get a clot. Based on your unique risk, we determine your need for postoperative blood thinners, and if so, how long do you need these? If you have significant risk factors, we may require you to see your primary care physician or a hematologist. If you need a blood thinner, it's important to know that if you fall, your risk of bleeding is increased, and this can become an emergency, especially if you hit your head. Despite thorough evaluation and proper management, blood clots can still occur. It's important to watch for the signs and symptoms of DVT or PE after surgery. If you feel you may have a DVT or PE and believe it's a medical emergency, dial 911 or proceed to the ER. Please notify our office of your concern once you're on your way or stable, but do not delay emergency care if needed. It's important to know, despite best efforts and at no fault of yours, anesthesia, nursing, or us, DVT, PE can happen, and it's important to recognize the signs and symptoms and get immediate care.